You may hear more and more people talking about having a mental breakdown. And although now we usually call it burnout or depression, a mental breakdown is a complete break. Like you're so depressed, so stressed, you can't function. You completely come to a stop. And some families are more prone to these. They have more underlying mental illnesses within the family. They may never have learned to cope with stress or anxiety or depression when they were growing up. They had bad influences. Their parents may have been addicted. A mental breakdown is very serious, and oftentimes people who live alone in particular are more likely to have a mental breakdown because there's not that other person asking or seeing what's going on. More than likely, they're able to cleverly hide it, or they just don't go out. They begin staying home. And when you're home alone and you're feeling stressed or you had a traumatic event happen, it's more likely that having a true, full mental breakdown would be possible for you. When people have a full mental health breakdown, they usually need to go into the hospital for care because it involves physical and mental, and the treatments are quite extensive now, and they take it very seriously. In fact, if that person says they're suicidal, then they don't belong at home. They belong in a mental health care facility where people are trained to keep an eye on them and start the therapy right away. So how do you know? What are the symptoms? Well, changes in sleeping or eating patterns, fatigue, brain fog, and these are things that don't go away. Fearful thoughts, you're scared all the time, you just want to stay under the covers, feeling overwhelmed, isolating from others, panic attacks, not one, but several. Every day you have panic attacks for at least 2 weeks. Mood swings, and memory or concentration problems. If you notice any of these symptoms, it's time to go in and talk to a therapist, talk to your doctor. Something is abnormal. These things come on acutely most of the time, and then they build, and they're consistent, they don't go away. I think it can happen a lot when a traumatic event triggers it. So let's say you were in a shooting, or you witnessed a shooting, or you were involved in a tragic accident, or you were at someone's house and someone pulled a gun out and was making threats. Any of those things where you fear your life or the well-being of someone else can be enough to push you over. It's associated with symptoms of depression. So if you've had a bout with depression that you haven't fully gotten over and you're still home feeling unmotivated, and sometimes stressors, if stressors compile and you're not able to clear them out or maintain some sort of control over them, if they're like just put on you and you feel like you have no ability to stop or to intervene, those things many times can lead to a mental health breakdown. What's important is that you understand there are things you can do. If you're with this person who is having a mental breakdown, you can start some of these. You're going to need to enlist the help of a mental health care professional, though, and perhaps a psychiatrist, because medications are oftentimes very useful in this. But these things sound quite easy to do, strategic, but they do work. The first of these, start deep breathing with a person, start meditating, start finding ways. What are the calmers? What are the self-soothers this person has as they've trained themselves to do it from childhood on? What are they good at with coping with stress? Start using their strategies, because when you use their strategies with them, you empower them. You make them feel more confident that this has gotten big, but they actually can work through some of these feelings. Journaling. I can't express enough the importance of writing down your thoughts, drawing your thoughts, whatever you can do. Those seem like esoteric, they're not. They make a big difference. Focus on what the person can control and what part they do have responsibility over. Things like what can they wear, what can they, what kind of toothpaste do they want. Break it down. Little things matter. Whatever they have control over, give them that control. That's going to help them get back on their feet sooner. Notice and question any negative thoughts that they tell you or they have. And when I say question, ask them why they think that, why they're telling themselves that. It's very important for them to start understanding that it's what they're telling themselves that's really making them feel out of control. Maintain a healthy diet, physical activity if it's possible. And by that I mean just walking a mile, walking a half mile. It's going to help with the brain and the brain chemistry start calming some of these symptoms down and making the patient feel more in control. Reach out for other support groups, friends, whoever you have that you know can be a helpful light at this time. If you're the person going through this, reach out to them. Tell at least 3 people what you're going through. Make that your goal. I need to tell at least 3 people. One of those people is going to come closer and start checking on you. And that's exactly what you need at this time. Avoid any substance, alcohol, cigarettes, gambling, shopping, whatever vices you use that have an addictive ability, you want to stay away from those now. You're very susceptible to that. So you don't want to do that. If they hospitalize you, what will most likely happen? Well, first of all, they're going to start treating you for PTSD if that's necessary. If you had a post-traumatic stress of some kind, they're going to treat you with that, probably with rapid eye movement therapy. They're going to do CBT, cognitive behavioral therapy. This is going to help get out those negative thoughts and replace them with positive ones, showing you that it's what you're telling yourself that's really getting in the way. Medications, there's a lot of good medications to help you through this traumatic time so you don't have to linger in it and so you can get well and go home and restore your life again. They may do brain scans. They now know which imaging in the brain is showing the depression, the anxiety, and oftentimes they can target those areas to restore you back to your normal self. And they're also probably going to start doing an online, not only online, but in-person group therapy, because we know that when people have a mental breakdown, the most important thing is other people are giving them perceptions of what they look like, when they say something, what is the feeling the other people are seeing transmitted on their face that's mirrored back to them. That's very hard to attain just in talking to people. Support groups are very helpful for getting you back on your feet. When you hear someone had a mental breakdown, it sounds scary, and it is scary if you're the one going through it. But there's so many good treatments. You no longer have to have mental illness limit your life this way. If this video is helpful for you, please subscribe. And if you're already a subscriber, thank you so much.